Hello, my name is Tahir Ali. Thank you for joining us. This is the presentation by Association of Pakistani Physician of New England. And thank you for joining us. I am going to be your Zoom moderator. And now, with further ado, I'm going to invite Dr. Yusuf Sheikh, who's the president of APPNE, to please start the program.
Thank you, Tahir Saab. Thank you very much for giving me the opportunity to speak to the audience. We have a wonderful panels today, and a lot of people have already joined our panel today. We are doing this event because this pandemic has affected almost everyone that we know of. A lot of people have died. A lot of people have lost loved ones. Every colleague, friend, anybody I know has been affected by pandemic, and in this global world, we have forgotten our kids. We have been the victim of this pandemic as much as we have been, and they have been affected. My kids have not been to school. I have three children myself, and they have not seen their friends. We have not traveled anywhere, uh, and so we wanted to do this webinar to help educate ourselves as parents, and to understand how we can help our kids, because the schools are likely going to open from next month, and then and the kids are already becoming anxious about hearing going back to school. The life is not same, there's not same school, same not the same environment. They will be wearing masks, they have social distancing, so a lot of things affected. And with this experienced group of panelists that we have today, who are experienced clinicians, we will be understand how we can help our kids in the community. Thank you very much, and I will ask Saud to take over from here, and then invite the panelists and introduce them. Thank you.
Um, right. So we have five panelists here today. I would like to go over the bios of everybody one by one, and then they'll go over their presentations. First of all, we have Dr. Parveen Rathore. I mean, she's diplomat, American Board of Psychiatry and Neurology in general adult psychiatry. She practices in child and adolescent psychiatry as well. She's a medical director for PHP at Human Resource Institute Hospital in the Brookline, Mass. She has special interest in women and trauma with ADHD across the lifespan. We have Dr. Zafar Naqvi, who is a psychiatrist and analyst and is faculty at Harvard Medical School. He works as a psychiatrist in charge at Norcog McLean Hospital. He's an international associate of Royal College of Psychiatrists. He's board certified in psychiatry and neurology, addiction psych, and addiction medicine. His areas of interest are eating disorders, bulimia, obesity, anorexia, borderline personality, drug and alcohol addiction. Our third panelist is Dr. Sadaf Ali. She is clinical assistant professor at the Department of Psychiatry and Human Behavior, Brown University of Warren Alpert Medical School in the Providence, Rhode Island. She's also attending psychiatry physician at the Providence VA, Butler Hospital, and the Landmark Hospital. Fourth panelist is Dr. Noreen Shafi. She's PhD clinical psychology. Currently, she does private practice. She's an ex-professor at Punjab University, Pakistan. She is ex-adjunct professor at Johnson and Wales University, Rhode Island. She has extensively worked with clients from very diversified cultural and social economic backgrounds. Our last panelist is Dr. Rifat Sharif. She's an assistant professor at UMass Medical School, Worcester, and she's an attending psychiatrist at Worcester Recovery Center and Hospital, providing the care for chronic psych illnesses. Thank you. And with this, I would just start our first panelist, Dr. Parveen Rathore.
Good evening and Assalamu alaikum. I'm Dr. Rathore, and I'm going to speak briefly about the impact of COVID-19 on adolescents and children. I will start with a graph which shows high symptoms of anxiety and depressive disorder during the COVID pandemic by the age. As you can see in the graph, 56.2% symptoms of depression and anxiety is reported by adult age from 18 to 24, 48.9 from age 25 to 49, and then from age 50 to 64, it drops down by 10% to 39.1. And again, at ages 65 plus, dropped down to 29.3. As we can see that the children, coronavirus or COVID-19 can affect children and young people directly and indirectly. Can we change the next slide? Many young people's social, emotional, and mental health have been impacted by the pandemic. It relates to changing their routines, break in continuity of learning, breaks in continuity of healthcare. Parents are not able to take their children to their regular physicians follow-up, so that is lost in this pandemic. Missed significant life events and lost security and safety. Like some people lost their jobs, they don't have money to even buy food, you know. Next slide. How we can learn to cope with stress in a healthy manner. Most of us can see that like stress can be in various forms, feeling of fear, anger, sadness, numbness or frustration. Sometimes you can see the children or the adolescent, they say, I'm not hungry, loss of appetite, or they may eat more, comforting themselves, low energy or variable energy, loss of interest in things, difficulty in concentration and making decisions. One of the other things may mean is change in sleep pattern. Some children will have no sleep or they will have nightmares in their sleeps. There may be physical symptoms of anxiety, headaches, body pains, stomach problems, skin rashes, asthma, any kind of like irritable bowel, any kind of symptoms related with increase in anxiety. There may also be worsening of chronic health problems and chronic worsening of mental health condition. We have seen increase in anxiety and depression as well as substance abuse in this age group. Also, suicidal thoughts, not that they want to kill themselves, but suicidal thoughts have increased by 25%. Increased use of, again, tobacco, alcohol, and other substances. It's a big impact on our adolescent. And if we are not aware of looking at these symptoms or don't address this at this time, it can make more problems or affect their life in general, as well as school and learning. I think I will stop over here and let the other speaker take care.
Dr. Zafar Naqvi.
Thank you, APPNE, for including me in this important session. Let me share my screen. I'll be talking briefly and going through the slides in 5 minutes because there's some other speakers, and then in the question and answer session I will be happy to elaborate further. So let's start with why COVID is different than the other anxieties. This question has been asked very frequently. If you look at the magnitude and the nature of this COVID being unprecedented, all of a sudden it basically got, fell at us like a bombshell. And the continuum, the duration that it is basically staying on and on is adding to the increased tendency of, making us anxious. And usually, because if you look at the loss of human life, we all have this experience. Like, for example, in US, 600,000 people die of heart attack every year. But the nature of it being sort of encompassing globally and have leaving people with no support, is making it multiplying it more, like the anxiety that we are feeling, which basically hammering the social support system and resilience and recovery. Also, being mammals, and I will further elaborate it in the question answer session, that being mammal, we have our survival strategies based on 5 basic attachments, and we are basically with the COVID is challenging us with separation challenges by challenging these attachments, the 5 attachments, and that's also the reason that it is coined that we should say not as a social distancing but physical distancing, so that the mind will still think that we are emotionally connected with people. A lot of studies coming up all around the world. I think Dr. Rator has very well mentioned in detail. I'll just go through some important things. Is overall, the study is showing that the depression and anxiety prevalence are increasing in both preschool and adolescents. The social isolation and loneliness increases the risk of depression, and the duration of loneliness is more important than the intensity of the loneliness. Then there, the kids who already have existing mental illness have more relapses and exacerbation of their symptoms, and some youths who have social anxiety may be finding it easier. Some also data showing that from the past pandemic that it may be difficult for them to readjust when they go back, when the schools will reopen. One thing which is very striking study from Italy and Spain, and I want to highlight it more, that they interviewed 1,100 plus parents of children aging 3 to 18, and almost 86% of the parents reported changes in their kids' emotional and behavioral activities, and including the difficulty in concentration, boredom, irritability, restlessness, nervousness. You can see these numbers. But the highlighting thing is the thing which is highly attached with the increased anxiety was the level of parental stress. And we know that the child development is basically attuned or defaulted with adaptability, but not in this kind of situation when there is no normalcy, no support, apprehension. And at this time, I think it's very important. I usually say that this is the goal for the parents is something that we should not lead our kids lonely or alone in their own worries. And how can we do that? There is always a parental language which has to match with the level of kids' development language. So what it is basically that children can sense their parents' emotions very quickly, but there are also different level of sophistication of human communication with developmentally also affect the children. For example, the age from 2 to 6, which is the preschool age, their main mode of connection is through feelings. It's a feeling language. Then the age 7 to 12, which is school age, is more action level, and the adolescents basically more sophisticated language, which is speech. So just to give you an example, that school age children, no matter what, even if you are talking to them, they can only be serious with your communication is when they see that you're making an action of engaging the eye with them. So they look, and you really have to go down to their level and make an action so that they can see you at the eye level, and they think that you're really interested in the talking, that you are talking to them. So the dialogue channel should never be misattuned. We are embedded in a layered context of meaning and structure, and any communication consists of an emotional piece and an informational piece. And as a parent, we should be very mindful of the fact that we should make this loop of communication well formed rather than having lopsided communication, which means misattuned communication. We should promote those activities of communication which can promote social competence and positive concept of self and others, while reinforcing the resilience and coping in our children. That promotes trust, autonomy, agency, and identity. This also lays the social, cognitive, and emotional platform for their future growth. also in adolescence, they are also going through this challenge of frontal limbic dissociation or frontal limbic mismatch, which I will explain later, but roughly or just in a nutshell, it is the imbalance between our emotional mind and our logical mind. Also, kids with age 4-7 have magical thinking, which means that they attribute everything, what's happening in the outside world, to their own doing and their actions, and they feel bad about their own self. And this is also a very important time of the building of their sense of conscience. So it is very important. And the reason I was just talking about this communication mismatching or misattunement is, there's a famous incident, I think you all know, that the Chowchilla kidnapping in 1976 in California, in which there were like 26 school children were abducted with the school bus driver when they're going to a like summer trip, and the kidnappers imprisoned them in a buried box truck within a quarry in Livermore, so inside, like underground. And then they actually were able to dig out themselves and escape, but the children were there for several hours, more than 9-10 hours, I think. And then what the point is basically that when they studied those children or those victims 5 years after the study, they found out that 100% of those kids have diagnosis of depression, anxiety, and PTSD, and because nothing was communicated to them that what happened, they were there, they went through that dreaded experience, and then nothing was said and explained to them, and they never had a chance to process those feelings. So we'll be talking also about the school reopenings, which is, we know that schools serve a crucial context where kids can make sense of their own lived realities through narrative thoughts of their own age group and recognizing and sharing their emotions. So we'll talk about that. Thank you.
Thank you, Dr. Zafar Naqvi. Next is Dr. Sadaf Ali.
Assalamu alaikum. Thank you very much. First of all, thank you to the whole team. Thank you to Dr. Yusuf for putting all this together. Thank you to the APPNE platform for the opportunity. So I'm going to start from the COVID stigma, one of the things which has damaged, which has affected. Dr. Yusuf, if I may have the slides.
One second, let me stop the share and then.
Okay. So it has affected everybody. We all have been in the same boat, under the same cloud, the frontliners, non-frontliners. It's something which we all are going into a challenge for. One of the biggest challenges are what to do, how to do, and where to do. It all started with multiple challenges because there is no routine, there is no structure. And on top of that, it is a condition of unknown. A lot of people do not know what is upcoming, and that has been how we spent the whole last year. Almost every year, it was almost every week, it was a change, it was an adjustment, it was a new thing to work with. So one of the biggest concerns, I would say, which has been affecting, yes, the emotional health, the physical health, and the societal and the social health, is that there has been a stigma of COVID where everybody has been feeling labeled, discriminated, treated separately, somewhat more fearful that if they express or they say, they might be considered in a certain category, they can't share, more so scared whether they should say something about it, confused, not expressing well. So all in all, I would say they are having a lot of problems with anxiety and depression. As Dr. Rathore very well explained, the levels went very, very high. Even with the perpetuating and the problems before, it has significantly added to the whole situation. The impact of that, the impact has been that people have been reluctant sharing their symptoms, honestly expressing what they are going through emotionally, with their isolation, with their conditions on a daily basis, with their change of responsibilities, change of duties, the balancing part, it has been significantly affected, and especially for the diverse community. We have multiple diversities all over. And it has been a universal change, change for protection, universal change for prevention, which has been one of the big challenges of COVID, how to deal with it. And the fact in reality is it's going to not get away with fear, but it is going to with conjointness, with all of us being together, talking, communicating, organizing the day. I would say having it week ahead organized so that you're not stressed out. We're talking about more so parents who are dealing work from home as well as teaching the kids from home. So now they're having double the responsibility along with what they were doing before. I would say starting to focus on self-care, as we very well always hear that put your oxygen on yourself before you put it for your child, because you want to be there for your family. Communicating. I always say 10 minutes, 3 times a day. Communicate with your kids individually. Tell them, ask them, make an open ground, open discussion. How is your day? What's been going on? What are you struggling with? Engaging, expressing, bonding, showing them that you are there for them. You are the first line. They can talk to you. Don't let them isolate. Don't let them get into any type of activities or unhealthy things. As the gyms are closed, as the schools are from home, the hybrid situation is much more difficult for them to socialize, to grow, to get experiences, to learn what they are supposed to at this age. So we are basically the ones who are going to guide them at this time as the frontliners. So developing open talks, avoiding isolation, using technology. I do say it's always helpful to use something like a mindfulness coach, which is available online, Calm, Headspace, any of those things. Just giving it a few minutes, it doesn't require too much. It just requires the intentional set aside time for that particular thing, and it goes a long distance. It does help a lot. Pretty much everybody has their own way of meditating, spiritually, differently, yoga, meditation. Mindfulness is one of the best ones. If you can look into that, as being a Muslim, 5 prayers, grounding down, stopping the day, analyzing what's going wrong, what's going good, and just putting it together and moving on. It's not going to make things perfect right away. Definitely will require time to balance it out, but limited screen time for the kids. A little parental control, I would say, in a balance, so that they're happy as well as they are not exhausted with the media, with the I would say the radiations more so, because that is going to affect their sleep. Watching closely their sleep cycle, that would be one of the priority as well. Watching closely, they're eating healthy, they're having some type of activity, physical activity. I would say something like a walk, something at home, a treadmill, or more regular thing, watching out their nutrition and hydration. These things are going to matter a lot. One of the link I found for remote learning online is www.educationworld.com. It is a good resource. It's Be a Learning Hero. And this is the National Teachers of the Year, which has posted very good tiny videos, which are very, very helpful for the parents and for the students, how to go through this pandemic and how to help with their learning in this new situation. As this is a new world, we are going to go and try to find as many innovations and new ways to deal with it. So helping with the togetherness, the conjointness, the family engagement, that is going to help a lot and go a long way. Talking to their teachers, I would highly recommend talking to their teachers just to get what they say about your child, because they are going to be the one which are knowing the most, which we do not know. So that would be more so of the mild category. That will be in the lower scores of the PHQ-9 and GAD-7, where we are anxious, we are depressed, but in a way that we are coping with it. And we just want to organize and reorganize and see what is going to work best for us. Talking about the moderate level, that is more so when the PHQ goes a little bit higher than 10 or the GAD goes more than 11. And that's where we want to has somebody involved, a little more catharsis, a little more discussing, and there's a lot of therapies, a lot of therapists, a lot of coaches, counselors, guiders available. You can outreach them so that you can analyze and enhance your coping skills. You can also add join groups online, and that is also going to be additional. Now, here is the question whether you are at a stage of you require medications, which are fairly a lot of them. Majority of them are non-addictive, and they have very good response. You don't have to be taking them forever and ever. It will be more so for a little time, and then once things get better, you can take it away. But again, that couldn't be without a further evaluation, a psychiatrist or a primary care evaluation. So they will decide whether it's the time or it's not the time. So I would say reaching out and kind of analyzing would be one good idea. Talking about severe, I would say when it's I'm totally stressed, very, very depressed. I don't know who to talk to, where to go, what to do. I just cannot move at all. So that's where the crisis line is there for. There are multiple resources. Dr. Parveen is going to share with us, and I'm going to leave it here.
Thank you, Dr. Ali. Excellent suggestions, and I personally use mindfulness myself as well, so that definitely works. Our next speaker is Dr. Noreen Shafi.
Good evening. This is Noreen. Thank you for joining and putting this meeting together, as we established that one of the most vulnerable population is the adolescents. So actually, we already discussed how it is impact most of us, or especially these teenagers. So I'm directly going to go into some of the strategies and coping mechanisms to have this for the parents and even for the adolescents, because we understand that trauma faced at this development stage may have long-term consequences across their lifespan. So first thing is that we have to acknowledge that they are the most vulnerable population, and these challenges these adolescents are facing not limited to change in their social and academic life routine, from choosing to escape in-person gatherings to consistently wearing masks in public settings or virtual learning. A lot of other things are happening to them, like breaking in continuity of your learning, virtual learning, which could make learning increasingly challenging for some of the students who have very limited resources. For example, access to a computer or internet, or some children I have experienced have definitely experiencing Zoom fatigue. And the last is now, since we are getting vaccinations and we are about to go back to the normal routine, they are also anxious about going back to school. Mostly parents are very concerned about sending their children, and especially adolescent and very young children, because young children have difficulty following the protocols. And teenagers, as you know, it's difficult for them to be very vigilant about following the protocols. So because staying home or limited gathering can force them to miss significant life events, from graduation, proms, birthdays, and even funerals, losing an opportunity to celebrate or grieve with friends and family. Some adolescents are also losing security and safety because due to economic crisis or increased online activity that can put them at risk for online harms. And I have been seeing this a lot in my practice now. Either children are very concerned about the socioeconomic status or things about that, and the parents are also concerned about their well-being. Can I have the next slide, please? Can I have the next slide, please? So, I mean, first thing we have to do, what we need to do about it. One thing we always underestimate, and that is that children have more resilient than adults. They can bounce back more easily than most adults. So first thing is that we need to recognize and address their fear and stresses, anxiety. Most of the time they are addressing or exhibiting these fears and stresses and through their different emotion, and anger is one of the most obvious emotion to express fear and stress, and it can be easily recognized. It is just like a volcano that erupts and lava comes out that is due to simply movement of plates under the lava. We need to identify those feelings or plates that are making this volcano to erupt. For example, isolation, learning difficulty, losing sense of belonging to a group or individuals or family. Anger always have a backstory, and normally this anger is due to some expectations. I cannot see my friends. We have to introduce them the concept of personal responsibility and safety. Keeping them safe and protecting others from this deadly virus should be the concept we should be talking to them a lot about it. Helping them to find mode of communications. I found it very interesting that old-fashioned writing letters and sending paper card is not only very exciting, also very effective. Can I have that slide, please? I have also found very interesting is that we need to kind of teach them to communicate whatever mode of communications we can introduce to them, as I said, whether writing a letter, sending a card, technology, or having, as Dr. Sadaf very rightly said, 3 times a day, sitting them and just talking to them, because communication is very important. Expression of emotion really helps them not to create a volcano. So there is a technique which we use is called leading by following. Especially it is very effective for adolescent, because the minute you kind of try to give them a suggestion, they get very defensive. So this technique, leading by following, means you allow them to freely express their thoughts and feelings. You just have to be there and don't without making any comments or making any judgments. So we can assess their feelings and their thought process, what are they thinking, where their thoughts are, what are their feelings. Giving them the trust to express their thoughts freely without any fear of being judged or reprimanded, because as you know, these teenagers are very defensive. So once you give them that open feel, as Dr. Sadaf Ali mentioned, that they need to have a place where they can easily express themselves. One of the technique is logotherapy, which is like a place where we use clients to not only freely express what they're thinking, at the same time understand or hear what they are not ready to hear from outside of that session. So that is also kind of important. We can discuss that later on. Once they develop that trust that they have been understood and acknowledged their feelings, then you can lead them by your help and support. And that's where, so it is like analyzing their thoughts and processing their feelings, and then giving them to the other end of the spectrum of logotherapy, that is like helping and supporting and teaching them what they need to hear. So if it is a stress, try to convert that into an excitement. Break the task into some small segments. As we all know, smaller the goal, easier to achieve. So if they are stressed out about a project, just kind of ask them to take one segment and do it, like putting one foot in front of the other. Second very important thing, which I think I would kind of emphasize to the parents, that we need to have a consistency and routine. We have to maintain a normal sleep cycle. Wake up at the same time every day to sleep at the same time, because this is kind of a circadian rhythm we have to have. But for parents, we have to be the role model. This is one thing I always teach parents. If you don't turn off your lights or gadgets at the specific time, don't expect your children to do that. We have to teach them. It is a new language we are trying to teach them to live in this pandemic. And that is like kind of maintaining some routine in this, because due to being everybody home, I have seen and I noticed that most people who come for treatment, they don't have a routine. Everything is very haphazard. That also gives anxiety. So having a routine would give them, like, what is coming next. It helps them to cope with the anxiety when we know what is coming next, what is going to be happening, what is the thing we need to do. So that is very, very important for the parents to do that. Can I have the next slide, please? So okay, so that is one thing and last thing is that there is a few books which are available. Like, for example, I would say that this is a book, When Your Child Needs Help. It is a very good parent's guide to therapy for children, and it covers for all ages, and it is written by Norma. We can give it to, and there is another book which is like, maybe we should talk to someone. That is like, as Dr. Sadaf mentioned, it is very important to keep the mode of communication open, whether it is between parents, children, whether it's between friends, family, or school, or even with the professionals. Thank you.
Thank you, Noreen. Now I'm gonna introduce my last speaker, Dr. Rifat Sharif. Please.
Assalamu alaikum. Thank you, Dr. Saud and Dr. Sheikh, for providing this opportunity and platform to talk about the mental health in children nowadays, which I feel like is parallel to the COVID pandemic right now. As we've heard from the other panelists about the symptoms, the challenges, and how common it is nowadays, often I come across families who have trouble seeking help. They really just do not know who to go to. What will be their first step? How do you approach someone? And the stigma is the biggest barrier, especially in our community where mental illnesses has not been as common, or at least perceived not as common. So in view of that, I think I was going to focus on what are some of the resources that are available in the community? How do you approach? Who do you call? What would be the first step that you would be taking after you overcome all the barriers and acknowledging, especially the parents or the families, that the problem exists and that there's something you can do about it? So in that respect, there are several behavioral health programs that are available for treating children's behavioral health issues. Basically, it is difficult for providers to navigate many systems of the programs and services that are available for children. So most of these services, when they are available to a particular child and a family, is often determined by the type of health insurance coverage. So I listed out some of the generally accepted levels of care that are available. The child's diagnosis and current symptoms and situation will determine which level of the care is most appropriate. So the outpatient behavioral health services are the commonest mode of the service that's available and people generally approach. During this, there are meetings with the professional therapists or counselors for a defined period of time, such as an hour and a half, are generally provided and after the appointment, and generally most commonly is in an office setting clinics or in individuals' home. One of the, I would say, sort of a positive thing in pandemic is that the telepsychiatry has been very common, which has actually increased the access to the care. And it has made it very easy for people who were initially reluctant to go to a psychiatric office or to talk to a psychiatrist it is now available at their own leisure, at their own, and there's a lot of flexibility around it too. So given that, I think people can have the help while they are in their home or at their work. So these meetings generally include evaluation, individual, group, or family treatment or care coordination. Urgent outpatient is a service for when you're not experiencing an emergency, but cannot wait for a routine outpatient appointment. So these appointments generally are available within 1 business day. Emergency services are usually available 24 hours per day, 7 days per week. The purpose of these services is to provide a rapid response, assess, and deliver a course of treatment intended to promote recovery and stabilize the crisis. These are generally provided at locations in the community, such as an individual's home or a PCP office.
Okay.
So to locate the emergency services team in your area, you can call a number or entering a zip code. So in coming up slides, I will talk more about that. Partial hospital level of care is generally to stabilize acute symptoms.
كيف تنطيهم إذا
Sometimes to prevent an inpatient hospitalization or the transition between inpatient and home services. So partial hospital provides the same intensity of diagnostic and clinical services, but not on a 24-hour basis. It is usually like a 6 to 8 hours per day. Inpatient hospitalization is the most intensive level of care. It is provided in a 24-hour locked, secure unit within a general hospital or a private psychiatric hospital. Inpatient services are generally warranted when the child is dangerous to him or herself or others, or is experiencing acute psychosis, or having delusions or hallucinations, or out of touch of reality. Residential services are also available, which are generally short-term acute programs, which are designed to stabilize crisis. Generally, when the environment that they provide an environment which is therapeutic and replicates a home-like environment for children who cannot live at home. Residential programs also include education component arranged with child's home school district. Can I have a next slide, please? So this slide actually provides some links so that which could be used by families as a guide. Samsha.org is a very family-oriented, informative site where a lot of information is available for substance abuse and mental health services that are available. National Advocacy Council is also an organization which has several links that leads to NAMI, which is the National Alliance for Mental Illness. You can click on those links on the websites and you can gather more information from there. There's another Parent Profession Advocacy League, which has been pretty informative and useful. Handhold.org is another sort of site, website, which provides a lot of information for families and help them to navigate through the system and the illnesses. Can I have a next slide, please? So MCPAP is a Massachusetts Child Psychiatry Access, which is generally a very it's a great resource for families who actually need an increased access for treatment regarding their children. So this child psychiatry resource is accessible through the primary care physicians through all across Massachusetts. This site provides quick access to psychiatric consultations and also facilitates referrals for accessing ongoing behavioral health care. This site also encourages and supports the primary care, the PCPs, integrating behavioral resources into their practices and works with the behavioral health and primary care providers. It is also available for all children and families through their PCPs, regardless of the insurance. And this is free to all PCPs. So in this slide, I've also mentioned some of the regional teams that are offered by the MCPAP, which consists of child psychiatrist, licensed therapist, resource and referrals, referral specialists and program coordinators. Next slide, please. In Worcester area county, there's a big network which is called Community Health Clinic. Through this network, services are available generally outpatient for mental health illnesses and substance abuse for youth and their family. So the outpatient services are available. There's a phone number to contact. There are several places. If you go onto their link, you will have more information there. It was difficult to put all the information in one slide. Worcester County Health Department also has listed services for substance abuse. As you can see, there's a link integrated in this slide. Child emergency mental health services are available. Mostly they are provided by the Emergency and Trauma Center at UMass Memorial Medical Center, located on the 55 Lake Avenue North. They also have a mobile crisis team, which does the evaluations through Community Health Link and access youth at their homes, schools, or in the community. So the evaluation link or the phone number is also listed. Next slide, please. In Rhode Island, I thought Dr. Sadaf Ali also mentioned some of the resources, but some of them are listed also. There's a Gateway Healthcare with the link. They have multiple locations. They have an urgent care, and it's a nonprofit organization. It has a social work and financial assistance available. They do mental health care in crisis on phone and guide accordingly. There's also a link for the number to call in emergency situations. Crisis and mental health services in Rhode Island are available through Pawtucket, Johnson, and Charleston. These are 3 locations with the numbers listed. There's also a non-emergent intake assessment for mental health. Next slide, please. So HRI, partial health program located in Brooklyn, where I think Dr. Rathore also mentioned, is a program which offers a variety of services. I would like to speak a little bit about the programs individually. For example, their STRIDE program is designed for the unique needs of people ages from 18 to 25 who are experiencing a wide range of emotional and mental health issues. They also utilize a number of treatment modalities and then new coping mechanisms and skills. They may include acceptance and community therapy, such as CBT, DBT, or expressive therapy. Their women's program is conducted separately from the partial hospitalization program, which involves evaluation, symptom management, stabilization, and discharge planning. They also, patients also there receive a multidisciplinary treatment plan and individualized care. The Triangle Partial Hospital program at this place is primarily geared towards LGBTQ identified people of ages 18 years and older. This level of care also involves group therapy, provides individual therapy, medication management, family education, and case management, and focuses primarily on symptom management and stabilization of the disorder. The General Adult Partial Hospitalization Program at this place also provides treatment for adult and psychiatric disorders while allowing them to return to their home each night. They also again provide group therapy, medication management, family education, and case management. The Dual Diagnosis Program is for adults who are suffering from co-occurring psychiatric and substance abuse disorders. This aims to stabilize both conditions and identify the root cause of the problem. The Evening IOP, which is an intensive evening intensive outpatient program, works through the mental health issues and achieve long-term stability without having to miss school or work. It also features group and family therapy to teach patients the coping skills. The Honor Strong program is a short-term program, which is virtual intensive outpatient program. It helps medical professionals and first responders return to duty or to help support while they are continuing to provide their current services to the others. This also includes group and individual therapy, helping medical professionals and first responders and to overcome challenges that they are facing in their daily jobs and duties. So just to wrap it up, at the end of the presentation, I would just like to add, I think once the family or the children or families or parents helping children overcome identifying the issue, I think the biggest barrier is already over. Once you decide to seek help, you could have several resources available. Technology has advanced many apps which are available in your phone at your palm, and you can utilize that. I think the assessment and triage of the condition is very important, which can then identify what kind of services would you need, what will be the best situation or the setting that the treatment is more conducive for. So thank you very much.
Thank you, Dr. Sharif, and thank you to all of the panelists for sharing their thoughts and their presentation. I mean, this is amazing. The amount of information it had was like a lot. I actually need to go back and take notes of some of them. So at this point, I would start with some of the questions that I saw were coming during the presentations. I think the first question is to Dr. Naqvi. I think the first is the comment that that like there are 3 levels of human communication based on the maturity and sophistication. So can you elaborate with some of the examples?
Yeah, sure. Can you hear me?
Yeah.
Okay, so basically, you know, when we talk, and if you can give you like 2-3 minutes to explain, is basically, you know, when we talk about the communication, it is on the developmental level. So which means that the communication of a preschool child versus a school-going child or a toddler or newborn is different. And we have to, as an adult, go to that level so that they can understand. So the basic thing is, if you developmentally look as a human being, when we are born, right, our emotions or feelings are born on a day one. We start to have a feeling toward our mother, father, caregiver, stepfather, stepmother, whoever is the primary caregiver. So our feelings, emotion, all kind of emotions, you know, whether primary or secondary, they're born on the day one, right? Now, and then at what point we get the power of speech as a human baby? 2 years or 1.5 to 2 years. So there is a time lag between the birth of our feelings and birth of our speech. So if we understand that, then let's move further, that there are different levels of communication. There are 3 levels of human communication. The most immature way of human communication is making other person feel how you feel. So a baby can make mother feel or father feel how. This is the only way. When the baby is born day one, that's the only way the baby communicates, right? That the baby makes mother feel like he or she is feeling. Okay, then the baby grows further, and the next stage of communication comes, which is action phase. Baby start to communicate by moving the limbs. That is the second level. It is not as sophisticated, but it is in the middle. And then the speech comes, which is the most sophisticated. If you see the implication, if you really see that all the wars, World War I, World War II, are basically fought in an action phase or a battlefield, right? And how they got resolved? They got resolved by table talks, by discussion, right? So whenever you use the higher level or more sophisticated level of human communication, there is less disaster, there is less loss of life. I mean, if you keep on fighting in the battlefield with an action phase, which is a premature communication level, then the speech, then there will be more casualties. So this is what I talk. So if you apply this again to the preschool, and this is what I was trying to explain, that the children who are like 4 to 6 or 4 to 7, their way of communication is emotional. Okay, now as long as these children, if you try to talk to them in a tactical language, which is a language with a word, right? If you want to talk to them, they will not understand that unless their emotions are calmed down. So what's the best way of calming someone's emotion? Just if you smile, right? One smile can calm down so many neurons. Now the child can only learn anything when they're emotionally safe. Okay, so that's the first thing that you need to do. You know, people say the games, you know, games provide. What is a game? Any kind of board game, any games. Games provide emotional safety. When your emotional bank account is full, then you move on to further. If you cannot cater the more premature way of communication, you cannot move. Now, let me just add one to that. And this is very fascinating because I think everybody knows this, that it goes through this process, that, you know, when we talk about our emotional mind and logical mind, right? In the adolescence, there is an imbalance between our emotional mind, which is impulsive mind, and the rational mind, which is more logical mind, right? And that's why all the impulsive thing happens in teenagers. If you really look at it as a human being, there is totally reversal of the feelings and action. So, for example, when you are not sophisticated at a psychological level, your feelings comes first, and the feelings leads to the actions. For example, when you are like a toddler or a 4 or 5 year old or some 9-year-old, your feelings, it comes first, and then you do action. Now, guess what? When you grow up, when you're 18 plus, then you have to change the script of your mind. Why? Because once your frontal limbic pathway is mature, your logical mind takes over, and then the whole game is changed. There's a different ball game. Now, please do not go for feelings first and wait for the action. It is the other way around. For example, when we grow up, there are so many people who keep on saying that, you know what, procrastinating, you know, I'm going to start by exercise. I'm going to exercise by, workout, going to the gym. When? Because they're feeling for that moment when they feel about that, right? That's never going to happen. That is never going to come, you know, till the day of judgment. Why? Because when you grow up, your action, your feelings tends to follow the action. So when you do the action, you go to the gym, then they release feel good chemicals, and then you feel better. If you keep on waiting for that magical day when you feel first and then you act, I think it is impossible once you are 18 plus. So this was the message I was trying to give. I hope that, I think this clarifies the question.
Yeah. Thank you, Dr. Naqvi. No, I think it's definitely very fascinating to learn about this.
Thank you.
So we're going to move to the next question, which is for Dr. Sadaf Ali. And the question is regarding the mindfulness for the anxiety management. And Safana would like to know that what are the resources that Dr. Sadaf would like to suggest for the patients. And I would just like to add my own experiences that some of the insurance companies do not cover the mindfulness-based stress reduction training, group exercises, or activities like that. So I don't know if she has any idea if the insurance company started to cover them or any free sessions like that. Thanks.
Thank you, Dr. Saud. So actually, there are some apps available. There are some YouTube videos available. These are more free for training, free for learning. And going through them, one of the best ones I always recommend is Mindfulness Coach. It is available online. You can download it for free. And you can just go through the different explanations. They have very nicely described the benefits, their whole mechanism of action. And it also gives like a little timeline where you can set up like you want to do a 5-minute, a 10-minute, or a 20-minute, which goes along the way. So you basically want to start with a 5 or 10 minutes, see how you feel, and get into the basics of it. It basically is a very simple thing, which is grounding the mind, just being quiet as a meditation, putting all the 5 senses in the present moment, putting the thought you have in a non-judgmental way and accepting it, neither saying anything about the past, neither for the future, but just in the exact moment you are. So again, everybody can choose their own times, morning, afternoon, a quiet time. It can require 5 minutes, 10 minutes, or it can increase to 20, 30 minutes. But that app has all these options available, so you'll enjoy it.
Thank you for answering that. The next question is by Amina Sagi from Dr. Noreen Shafi, but actually I think she did ask about the names of the books, and she, Dr. Noreen Shafi actually did reply it on the chat. So we would, and the books are actually When Your Child Needs Help by the Norma Daft, All right, so we're gonna go to the next question. And
Just add one more thing about the mindfulness question, because I practically, so there is one thing which without any coach or anything, all parents can do is a term called no time. So we all need to schedule no time. That means we are not doing anything during that time, and it could be only 5 minutes. And the best way to do is just like not doing anything or not even thinking about doing anything. And the best way, as Dr. Sadaf said, to be in the present moment. And the best technique for children is that parents can just ask them to put their hands on their stomach and push it inside. So it is psychologically bringing you in the moment right here. So that is the first step of mindfulness, and that can be done for 2 minutes, 3 minutes, not doing anything, not thinking about anything, and it should be a part of the routine. So just an addition to what the question was for Dr. Sadaf.
thank you very much. So the next question we have is by Naveed. When the depression and the anxiety is due to COVID-19 social isolation, why use medical intervention when it can be cured with socializing in a safe manner? Dr. Rathod, do you think you want to answer that? Or anybody else would like to take it?
Yeah, I can address a few aspects of that. So what we prefer is basically more like for small children, play therapy or individual therapy with a child therapist, or if they are older, with more like CBT, or I don't know whether DBT work with that age or not, but more CBT and play therapy. The medical intervention comes when we see clinical symptoms of depression. And what does that mean, clinical symptoms of depression? People can become depressed. Something happened and they become sad, I'm depressed. But that does not last for long. It's more situational. But if the depression symptoms, like being depressed, last every day for more than 2-3 hours for at least 2 weeks, along with other symptoms of depression, which we call as the core symptoms of depression, as sleep disturbances. People complain, I cannot sleep, or they're sleeping too much. Same thing with appetite changes. They either are not hungry or they will just self-medicate themselves with just food, more like comfort foods like pizza, pasta, things like that. Then they will complain if they have no energy, like they are sleeping too much or they're sleeping all right, but still they have no energy. Sometimes some people will say, I have energy, but I have no motivation. There's nothing to motivate me, especially with this situation in COVID. Now, I mean, we have more to look forward, like schools will be opening and life will be almost coming back to normal. But when during the COVID, people have basically no motivation to do things. Then the other thing which comes is suicidal thoughts. Suicidal thoughts is different than making an attempt. So the last symptom which comes with depression is when you start feeling suicidal or feeling guilty or remain in your mind from past things and cannot come out of it. That is the time when medication or seeing a psychiatrist for medication evaluation is very important to prevent. Why we treat depression? We treat depression so we can, when people are depressed, they lose a part of their life and decompensate and difficult to recover. We treat depression to prevent people from prevent people from decompensating or return to normal level of functioning, to prevent suicide, to prevent everything which comes being becoming depressed. So there are many medications with children. We avoid using antidepressants, but if it comes to a point where a child is hearing, I mean, it's seldom happens, child will say, I'm hearing voices, but they do, things like that when we start antidepressing. In adolescent, again, try to do it with CBT, DBT, therapy. We have different partial programs in our system. We also have partial program in the Arbor healthcare system for children. Although in Arbor, we have for adults, all kind of partial program. But go to a partial program. Very intensive therapy we provide. But if still a person needs medication, then they need medication. Start with the sleep, targeting the sleep, or start with a medication which can target both sleep, anxiety, and depression. So it all depends what you are presenting with me, but presenting with symptoms. But medication becomes very important if person is very clinically depressed. And I told you the clinical depression is depressed mood every day for more than 2 weeks with other symptoms. They just become mostly non-functional. Like
I think I was just going to add one last comment regarding the socializing in a safe manner question, because I feel like as a physician, I can just add to that, you know, during the peak of the pandemic, I mean, there was like no socialization was considered as the safe one, because like when we were at the peak at the first week of January, it was really bad. That nothing was considered safe. Hopefully we have crossed the peak now, and with vaccine and the variants like not too bad. So I think with the governors relaxing some of the restrictions, things are going to be a little better, but things were really bad in terms of like socializing in any form was not considered the safe. Right, so moving on, the next comment is from Dr. Sharif regarding the medicinal intervention is always provided considering the risk versus benefit and the severity of the symptoms, determining if there is a need for the intervention. So the psychiatrists usually have to think a lot, and then benefits, the risk versus benefits. So medicines usually are not the first line of the treatment. Then Tahir Ali asked a question that, can we use Zoom platforms to compensate for the e-house arrest mode in the teenagers? It's a very interesting question. Not sure who would like to answer that. Rifa, do you want to take a go at that, or Sadaf? Arrest mode in the teenager?
It's a very difficult question, a very important question as well. Again, the concern comes down to our options at this time. This is a new world, a new situation, a new setting. What can we utilize? So this, I will say, is the bare minimum could be done with the Zoom. They are doing the hybrids. They have already working with that. Half class attending at one time, half class attending at later time. So that cuts down the number of people in the school. But again, the number of people in every class are way so many that we cannot adjust to it. It's totally something which our era has never ever experienced before. So unfortunately, Zoom was the most communicable, and I would say not just for schools, for hospitals, doctors, patients, everywhere. Zoom has been the most socializing thing, connecting, being together, other than FaceTime, I would say. But the thing here is that we have not created or innovated another option other than Zoom. So basically the practical presence there, and then the non-practical presence with Zoom, these two has been the only two platforms till now.
Thanks, Sada, for answering that.
Doctor, can I add something to that? The reason I was asking that question is that we use Zoom for mostly now weddings, anything that we can do. Normally we can use it for the adolescents I'm talking about, for the people who are under house arrest right now. Can't we do something like that for them? They can socialize among their own groups, and parents can probably
Yeah, we can hear.
So I just wanted to add, I think the Zoom meetings and telepsychiatry and being on the Zoom has actually helped reduce anxiety for children who are suffering from anxiety. It has made a lot easier for them to participate in many activities. So on one side, we are seeing that as a kind of limitation for social interaction. But on the other side, for children or adolescents who are dealing with severe anxiety, which they felt uncomfortable when they were in school settings or in some places, they have really utilized this as a resource for improving their interaction and self-esteem. I just wanted to add that. Thank you.
Thank
Can
you.
I add
Zafar?
something to?
Can I make a comment?
I have a
Yes, please.
comment, Tahir bhai.
Yeah, I think Noreen first, and then sorry, Zafar Bhai first, and then Noreen second.
Yeah, I just take 30 seconds. I think you have a very relevant question. When you talk about teenagers, right, you have to divide them into early teen or late teen, because their preferences changes, their language changes. So the early teen, right, they again, they're into action phase. So yes, they may be bothered by being house arrest versus going out. When you go further, the late teen, I think they started to have more sophistication in their language, and they basically start to use their language for coping with the anxiety. So I think this is very important, how as the adult, we think that what we see as an anxiety is what the kids are seeing. I think we need to sit with them and listen to them. What is the specific component of their anxiety? Thank you.
Thanks, Noreen. You wanted to add something?
Actually, it is a kind of a same thing like Zoom, but it is slightly different. Sling TV is offering like you can watch movies in your own house, but at the same time, or you can have few things like you can do like virtual parties, or I have recommended actually teenagers to make a group and visit virtually a museum and then have a discussion on that. I mean, it is not 100% a Zoom, but at least it's beneficial. It is informative, and it is kind of they're looking at something different than just kind of looking at each other. So just a small practical suggestion.
I agree with that. Moving on to the next question would be from Safana. It's regarding the school reopening, like, and the children's mental health at that stage when the school, especially for the kids who have been at home, like attending from 100% from home and now are going to the school after a few months. And I've definitely seen some level of anxiety among my kids as well regarding that. So anybody who would like to take that question?
Can I take it?
Yes, please.
So the anxiety is within parents and within children both. I have seen parents getting very anxious about sending and children very excited to go back to school, or is the vice versa. Parents want the children to go and the children, they don't want to go because now they're at a comfort zone because they can get up, they don't have to, rush. So it's both way. So first we need to identify what the anxiety is about with the parents. Mostly with parents, the anxiety is about children getting sick. And that we know, as all physicians sitting here, they can verify that, children are not as vulnerable to catch this disease as, adults. At the same time, if you look at all the schools, they're doing whatever they can do to minimize the disease spreading this pandemic. Like as Sadaf said, half hybrid, half in person, half in school. So that for parents, they need to look into the school and what they are offering and what measures they're taking to keep the children safe. So every school has different protocols a little bit, but you can look, and also you can give suggestion to your schools. And right now schools are very open about listening to all the suggestions parents are giving because they want the normal life back. Second is about children. So again, you have to identify what a children is anxious about. Is it that because now they have separation anxiety, especially from younger children who've been home for a year under the comfort of their parents or mothers especially, and they don't want to go back because or they are old or teenagers, and especially in middle school children, I see they are more anxious about getting sick because they do not have enough information. Younger children don't understand a lot of things, so it's like ignorance is blessing. Older children can comprehend and they can take the measures, but the middle school are the most who are very anxious about going back. So the first thing is that you need to be very honest and open about your communication. You need to educate them, about how this can affect and what are the things you need to do to keep yourself safe. Other thing is that maybe every child has some specific anxiety that we can address separately, and the best thing is like communicating and letting them express how they feel. But I think it's more like the parents who needs to control their anxiety before they can work on their children anxiety.
So I just wanted to take one break and ask Dr. Yusuf Abdul Aban to join the conversation. He's the president of the Islamic Society of the Boston. Dr. Yusuf, you want to say something?
Yes, Assalamu alaikum all, and thank you very much. If anything, actually, I want to thank the Association for Pakistani Physicians for taking the initiative. I see many friends here, Tahir Ali, Noreen, Dr. Thor, all the friends actually, they're familiar faces who have helped in the past. But something I would like to say and really taking the initiative, well, I think a year ago, we all witnessed that ICU doctors were at the forefront of confronting COVID-19. However, we all know people who are in the mental health and behavioral health profession that post-COVID-19 infection will become the crisis actually, where will probably fall on the shoulder of behavioral health professional, psychiatrists, psychologists, and it looked like actually we started seeing the tip of the iceberg, but more to come at many levels, at family levels, individual levels, and at many, many other levels. And what I look here actually as we people who are whether immigrant or even born here, but have family of immigrant root, we see the enormous stress we go through, whether in our family or our neighbor or our friends. And I wanted to mention something again here, not only thanking elite physicians like you to address it, but also how could we bring other behavioral health and mental health professionals to provide further services. At the Islamic Society of Boston, and I'll conclude here, we started putting together a healthcare committee, and we have about 30 to 35 healthcare professionals, all in the behavioral health, psychiatrists, psychologists, therapists, who are going to meet in 3 weeks to find a way to address the need in our community from a triage perspective. Not that we will turn the place into a clinic, but we need to really be at the forefront and see what is going on in our family, in our friend, in our colleague, and what could we do. And I would like to take this opportunity to say we are extending hand to work with you, as well as with any other behavioral health professional, to really extend our hands to and put our hand together to see what can we do for everyone in this society. Actually, we are in debt to really put our effort together to help everyone needed help. So I don't want to say much. I think you said it all. The presentation, the presenters were outstanding and excellent information. I think we all need it. And I thank you all.
Thank you, Dr. Yusuf. Appreciate it. Thank you for your comments.
Right.
So continue the
so-
questions.
Yeah, no, thanks, Yusuf. So I just wanted to do a quick time check right now because I know it's kind of a hour and a half mark, 7:28. So we will still take one or two last questions, but if your question doesn't get answered, please private message me on and your email address, and we will have one of our panelists reach out to you regarding that. But I'll just take the next question in the meantime. Solal is asking a question. As a teacher, is there a way to motivate high school students to try to get schoolwork done? This is very interesting, and I would like to know the answer to that.
Can I just give a very important thing here? I mean, just one comment on that.
Sure, go ahead.
So I think this is, if you look at the disasters in the past, if you really look at the upsurge of actual suicidal rate in Nevada in, I think, mid of last year, when they have like 550 times higher rate of actual suicide in one of the Clark district. And there are so many factors which were basically people wanted to find out, and they did. And one of the factor was, and this is important thing, is because we are at the stage now to sends our kids back to school. Is one misconception that, when you the teacher has to play a very vital role in separating two things. One is when you are starting. So if you look, like, it's been 1 year, right? The kids are off. Now, when the kids are starting back, what they, if they really want the kids to be more safer, because they're already very anxious, everybody, parents are anxious, is not to put too much emphasis on finishing the curriculum. I think they really have to give the time. I talk about the Chowchilla kidnapping. That's what happened in that as well. There was a disaster. Is give some time, because kids basically grow more when they're given options for narrative stories, because some kids did even not have a chance what happened. So when they go back to their age specific group, when they can have their own narrative and they share their lived emotions, that's the first chance after 1 year they will be having. So let them loose for a while, ask them to basically come up with some stories, that will basically give them some relaxation, rather than starting to put the load of curriculum from right away. So if you give them to expand on their thoughts and process those feelings, which probably most of them have never had a chance to. So just a comment here.
Thanks, Dr. Naqvi. I would see if somebody else also would like to answer this question. As a teacher, is there a way to motivate the high school students to try to get a schoolwork done? And as a parent, how you can motivate your kids to do that. So open for anybody.
Dr. Rifat hasn't answered any questions yet.
Tough one.
No, yes. What I can say from my personal experience is, I think high schoolers, it's already a very tough time, and pandemic has not made it easy. I feel like positive reinforcement works at any time. So as a parent, and of course teachers, they have their own ways of doing things, but I think positive reinforcement is a big motivator. So if you know what your child likes, or what can bring a smile, or something that they look forward to, you can attach a task with that, and then just reward instead of taking away things from them, which is like a negative reinforcement. But if you give them a reward for the things that they really do and achieve something, and also, like, sometimes if they're not able to achieve, just kind of like ignore that, let it go, don't make a big deal out of that. Just focus on their positivities, and just continue to appreciate. We are from culture from where it's very easy to kind of let go what the child has achieved, but we focus more on what they have not done. So I think if we reverse that, that is going to be a big motivator that I've observed in my clinical practice too.
Just can I just a small comment on that?
Please.
As Dr. Rifat said, that like focus on what they are achieving right now. Also, like if you kind of show them the end product, that if you do this, you'll be graduating, you'll be going to college, you'll be out of this situation, because we all like the end result, if that is kind of showing the light at the end of the tunnel. So even for high school, I have to ask the parents to buy a frame, an empty frame, so they can put it in his room, so he knows that this is for his high school diploma. So it's like kind of a giving them a reinforcement, as Dr. Riffat said, and a kind of a sense, kind of a looking forward to do, achieve something, end product, or a trophy, or going to college, or some freedom, or getting, not being hijacked in the house and going to college. Otherwise, if they don't graduate there, then what I say, you'll be in the parents' basement for next another 10 years. But if you graduate, you will be out by next year, please. And the more you're going to work, the better scholarships you're going to get. You're going to be going further away from the basements. So just a comment, sorry. And that's how you have to talk to them.
No, I agree, definitely. I think some of those techniques would help. Dr. Sheikh, question from Dr. Naqvi, that how and why the COVID or pandemic is different from other stress or anxiety. I don't know if that was answered earlier or no. Dr. Naqvi, did you answer it already or no?
No, I did not.
So how is it this COVID stress is different than the
I know
previous
what, no. I think this is the one, basically the one initially I was not able, my slides were not, run, that I got a feedback. So I don't know if I can run my slide now, but let me explain it to you without the slides. This is actually a very important sensor, that why the COVID or any pandemic is different from the other stress. It's basically, when we say that it has to be said as, physical distancing, not social distancing, is the answer is embedded in that too. So if you look that we all are mammals, right? And mammals have attachment needs. All mammals have attachment needs. What COVID is doing, whenever you have a stress, so there is always a shoulder to cry or some support available, right? Now, if you look at the magnitude, how it is basically encompassing the globally, so it is taking away your support, right? Two, the amount of the time is infinite. So anything which is infinite can increase your anxiety, right? If you don't know when it's going to end, that's further increasing your anxiety as a human being. So two factors. Now, what are the attachment needs for mammals? There are 5 basic attachment needs. And COVID is actually hitting each and every one of those. So number 1 is our need for sustenance, like food. Everybody wants food as a mammal, right? Now we have attachment with food and with the sustenance. We have seen the deserted scenes in the grocery store that, no food was left. So this kind of a message mind was getting for the first few months. So that is number 1. There's a huge impact. Number 2, we have the attachments or social needs. Hello? Oh, thanks. Yeah, can you go to slide number 3 and 4? Yeah, thank you. Yeah. So there, I think I already covered that. If you go to 4, the next slide. Yeah. So the need for this attachment socially is basically linked with our emotional needs. If you keep on giving this message to your mind that that you are socially distant, it's going to hit in our mind that, okay, this is another attachment need as a mammal, which is basically taken away. So you could actually, the more you say that it is a social distancing, that further endorse that, okay, well, this means that there is no emotional connectedness. So that's why if you say physical distancing, this means that you still can connect emotionally. And then the future goals, the reproduction, your procreation, a loss of the loved one, right? It is happening right, left, and center. Future goals. I mean, somebody was commenting, and I agree with them that, the parents, yes, parents can try to help the kids. But how about if the parents doesn't know the answer themselves, right? Because there's so many things which is up in the air. So this basically multiplies, and the kids can sense the problem which with their parents faces, that they do not have good answer for them. If sometimes we try to hide and sort of kind of optimize the answer, but that is kids can sense that, because make sure that we should not be over elaborating, but also not under elaborating, because kids also have, if you try to like too much minimize the COVID problem, right, then the kids have elaborate memories and they can come up with their own fantasies and create a monster out of that. So make sure that we're providing good optimum information. Future goals, kids, graduation, we see. So all these things like are basically hit by the COVID. Our beliefs, religion, philosophy. So Eid, Christmas, right? Rosh Hashanah, all these things basically went without any kind of convivial event or any social. So that is the reason that this is COVID or any pandemic is actually different from any other stress. Thank you.
Thanks. I think the next question is, actually, I would ask Dr. Yusuf Sheikh to see what his thoughts are in terms of either replying to the rest of the questions through the email, or should we just try to go through them quickly?
I think it's 7:38. I think people will start leaving. So we can just do one more question, last one, and then end it there,
Okay.
I think one question, Islamic centers and masjid can help. How they can help, I think it's a very important question.
Okay, yep. Does anybody wants to take that question? How the Islamic centers or the mosques can help in these kind of scenarios?
Yes.
Especially now that you cannot visit them that often, most of their lectures are also online and stuff like that.
Yes, I would recommend to have to share the resources as much as possible. Encourage with their bans, with their talks on Jummah prayers. Encourage so that people can come and talk about it and feel it and ease about it, that they can discuss and share. And I'm very glad that they're doing the triage program. That is going to be a very, very good initiation of this whole open talk and people to reach forward and talk more. So I would say just spreading out the resources wherever they can send. Dr. Rifat has very nicely put together a bunch of resources which will cover pretty much the area around, and that would be very helpful.
Thank you very much. I think there's one question which I thought could be a quick question, and it was kind of interesting. It's important because there's a comment of the it was regarding how to navigate the system regarding psych disorders if you do not have insurance.
So I can comment on that. So generally, these psychiatric services are provided if people have health insurance coverage. You would have very few or almost negligible resources that would provide psychiatric care if there is no insurance. Fortunately, in Massachusetts, we have Mass Health, which does provide, there is sort of a built-in resource within the Mass Health to provide for the psychiatric care services. Outside of that, I guess on our APPNE website, we have listed sort of resources to kind of have a consult, which is volunteer basis. So that's another means of doing that. It's very hard without the health insurance, and unfortunately, that is a big barrier for many people to access this care. If somebody has a primary care services or primary care provider, that is the place to initiate. Sometimes the primary care provider will be able to help with the problem, which is minor and not as requires as urgent or emergency services. But if somebody does not have a healthcare insurance, but they are dealing with a matter which needs an urgent or emergent care, I would suggest to seek the psychiatric care services, emergency services in the nearby area. So, If anyone else wants to add to it, most welcome.
Yeah, I think Yusuf also shared our website resources. I think we definitely have resources on our website, appne.org, and please go visit that. And then that gets updated frequently and also has a lot of free resources if you do not have the insurance.
I think with this, we will like to end the webinar. It's 7:42, and I appreciate the panelists and I appreciate the audience for joining us today. It was a worthy discussion. Unfortunately, we couldn't answer all the questions people ask. We are more than happy to answer any question through the email. Our email is appne1947@gmail.com. The panelists, their names are available on our website. This video recording will be available on the YouTube, so people can watch it. We're more than happy to answer any questions afterwards and collaborate with anybody, any organization who wants to help us spread this message and help our community members. I greatly appreciate Mr. Tahir Ali, Saud Javed for moderating the event, and our panelists obviously, and the ISBCC for helping us with the spreading this message about this webinar. Thank you very much, everybody. Everybody have a good night. Enjoy your rest of the weekend. Thank you. Good night. Bye bye.
Thank you.
Thank you. Good night.